6 signs of a silent heart attack that you cannot ignore. Did you know that between 20% and 45% of heart attacks are silent? Indeed, many people are unaware of this, but the truth is that not all heart attacks are as dramatic as depicted in movies. Sometimes the signs are subtle, minimal, or even non-existent. Therefore, it is important to be alert to any changes in your body. In this video, you will learn more about what a silent heart attack is and how to identify its signs. But what exactly is a silent heart attack, and how does it differ from a typical heart attack? In the case of a typical heart attack, also known as a symptomatic heart attack, the symptoms are very clear and may include chest pain, shortness of breath, sweating, nausea, and vomiting. These symptoms are usually intense and immediate, indicating that the heart is not receiving enough blood. However, in the case of a silent heart attack, as the name suggests, there are no clear symptoms, or they are very mild and can be easily mistaken for other health issues. Often, the person doesn't even know they've had a heart attack, which can be dangerous as it increases the risk of serious complications, including sudden death. It's important to remember that despite the differences in symptoms, in both cases, the heart muscle is suffering damage, and medical help should be sought immediately. Early diagnosis and appropriate treatment are crucial to preventing complications and saving lives. How does a silent heart attack occur? A silent heart attack happens in the same way as a typical heart attack, but without clear symptoms. The primary cause of a heart attack is the obstruction of blood flow to the heart muscle, usually due to the buildup of fatty plaques in the coronary arteries that supply the heart. The coronary arteries are responsible for transporting oxygen-rich blood and nutrients to the heart muscle. When fatty plaques build up on the walls of these arteries, a condition called atherosclerosis occurs, characterized by the narrowing of the arteries and reduced blood circulation. Over time, these fatty plaques can grow, harden, and even rupture, releasing substances that cause inflammation and blood clotting. This can lead to the formation of a blood clot within the artery, blocking the flow of blood to the heart. Why it's important to recognize the signs of a silent heart attack. Recognizing the signs of a silent heart attack is crucial because this condition can go unnoticed and lead to serious complications, including sudden death. Data reveals that silent heart attacks are more common than most people realize, and many individuals might be experiencing a cardiovascular event without being aware of it. According to the World Health Organization, cardiovascular diseases are the leading cause of death globally, accounting for about 17.9 million deaths annually. Moreover, studies show that silent heart attacks may be more prevalent in women than men, and are associated with an increased risk of future cardiovascular events, including acute myocardial infarction and stroke. Therefore, it is essential for people to be vigilant about their bodies and seek medical attention immediately if they experience any symptoms or chest discomfort, especially those with risk factors for cardiovascular diseases such as high blood pressure, diabetes, high cholesterol, smoking, and a family history of heart diseases. You might be wondering, what are the 6 signs of a silent heart attack? Although a silent heart attack might not present clear symptoms, there are 6 indicators that can suggest the occurrence of a cardiovascular event. 1. Excessive fatigue. Feeling unusually tired without a clear reason, even after adequate rest, may indicate that the heart is not functioning properly. This occurs because the heart muscle needs to work harder to compensate for the lack of blood circulation. 2. Shortness of breath. Difficulty breathing, even when at rest or during simple activities like climbing stairs, can be a sign that the heart is not receiving enough blood and oxygen. 3. Nausea or stomach discomfort. Some people may experience nausea, indigestion, or stomach discomfort during a silent heart attack, especially women. 4. Pain in the arm, back, neck, or jaw. Pain in areas other than the chest, such as the arms, back, neck, or jaw, can indicate that the heart is not getting enough blood. 5. Cold sweat or dizziness. Feeling dizzy, weak, breaking out in a cold sweat, or experiencing palpitations can be signs of a silent heart attack. 6. Insomnia or anxiety. People who have had a silent heart attack might experience sleep problems, insomnia, or anxiety due to the emotional and physical stress caused by the event. You might be wondering, can a silent heart attack be prevented? The answer is yes. Preventing a silent heart attack is essential for maintaining cardiovascular health. There are several measures that can help reduce the risk of developing cardiovascular diseases and, consequently, a silent heart attack. 1. Healthy diet. Adopting a balanced and healthy diet rich in fruits, vegetables, whole grains, fish, and lean meats, while low in saturated fats, sugars, and salt, can help prevent cardiovascular diseases. It's also important to avoid processed foods and fast foods. 2. Regular physical activity. Regular exercise is crucial for cardiovascular health. It is recommended to engage in at least 150 minutes of moderate physical activity or 75 minutes of intense physical activity per week, such as walking, cycling, or swimming. 3. Stress management. Stress is a risk factor for cardiovascular diseases, including silent heart attacks. Therefore, it's important to adopt stress-reducing measures such as meditation, yoga, breathing techniques, relaxing activities, and hobbies. 4. Regular medical checkups. Regular medical exams are essential for monitoring cardiovascular health, especially in individuals with risk factors for cardiovascular diseases like high blood pressure, diabetes, high cholesterol, smoking, and a family history of heart diseases. Key exams include blood tests to assess cholesterol and blood sugar levels, blood pressure measurements, and electrocardiograms, ECGs. Adopting these measures can help prevent cardiovascular diseases and reduce the risk of silent heart attacks. It's important to remember that each person is unique, and prevention measures may vary based on individual circumstances. Therefore, seeking medical advice to identify the most appropriate measures for each situation is crucial. I hope you have learned more about what a silent heart attack is and how to identify its signs. Remember that prevention is always the best remedy, so take care of your health and pay attention to your body's signals. If you know someone who could benefit from this information, please share this video with them. And don't forget to like and subscribe to our channel for more content like this. See you in the next video.